Welcome to Glow Up and Get Real. I'm the Sweet Face Injector, and today I have Dr. Amber Shaffer. She has been a nurse for 12 years, started as an x ray tech in 2005, became an RN with her BSN in 2013, and got her doctorate, her DNP, in 2023. She has been injecting multiple clients in Southwest Florida, and she knows what she does. She is an expert in lip injections and also facial contouring and balancing. Hi, Amber. How are you?
Doing well, thank you. How are you?
Good. Thanks for coming on.
Thank you.
I have some questions. We're going to talk about some funny things that's happened in the spa with you and me, and just kind of go through some of the questions we hear from our clients, as well as some questions that we hear outside of the spa. So you're ready to get started?
Absolutely.
Okay, let's do it. Let's do it. Welcome to Glow Up and Get Real. I'm Amy Ingle, the Sweet Face Injector business owner and trainer. Every week, we're injecting the latest on med spa trends, client concerns, and the boldest new treatments out there. Want the latest in safety, advanced techniques, and business strategies? You're in the right place. So, let's glow up, get real, and level up your beauty game. I'm going to start with the first question. Have you ever had a client ask, will I look like a duck after lip fillers? How did you respond?
Almost everyone I inject with lip filler are always questioning,
Yes.
even with the lip flip. So I tell them just simply, no, I'm not going to let you look like a duck. Simple.
Yeah.
Yeah,
Lip flip's always a good thing to start first. No one's had lip fillers before. Kind of give them a little taste of a little bit of a volume increase. Don't you agree?
yes, absolutely.
Yeah.
Mhm.
Yeah. Because so many people are scared to make that first jump into getting a little volume in their lips.
Right,
Think
right.
a lip flip is perfect, and we used usually Jeuveau, Botox to put a couple units in the top part of the lip, and it just relaxes that orbicularis oris to kind of do a little flip and give a little volume, but it does not look ducky. But how do you not make patients ducky with filler? Because that can happen.
Well, I don't go above and beyond one syringe. That's the first thing. Usually, when I complete the lips, I have some filler left over that they can just come back and get a touch up if they need to. I definitely, to prevent sausage lips as well, I don't go to the corners here because that just looks unnatural.
Okay, all
Yeah.
right. Clients ask me all the time to do that, though. They're like, I want it thicker out here. Mm-hmm.
I try to avoid that. Like, I'll go like from the outer nose here
Mm-hmm.
down. I don't.
Okay.
'Cause I feel like it does look like sausage after a
It
while.
can. Yeah, it can look like a sausage roll. A little weenie.
Yeah, exactly. So that and I go straight down depending. So I'll have people that want the natural lip, and so I have done it to where I go sideways within the lip. But then if people want more of a pout, I'll go, like, down.
Mhm. Like a so you'll do fencing with a pout,
Yes.
and you'll do like a linear along the wet dry border.
Yeah.
Okay. Alright,
Yeah,
cool.
for that natural look. That
Mhm.
kind of avoids the duck lip if you're going this way. You don't get it this way, but
Fencing.
yeah,
Yeah, you have to be really careful you don't put too much in, or you can
exactly.
totally make a duck lip with fencing if you drop too much filler at the top of the vermilion border. Yeah, I agree, I agree. Have you ever had anyone pass out? Times.
2, I had
What
2.
do you do for that? I just tell my clients, "Hey, if you pass out, I'm just gonna keep going. You won't feel a thing. And by the time you wake up, voila, you're done." Yes.
Yeah, and it's all the same. They all do the same. So I at the one time before I got smelling salts for the ammonia,
Yes. Good
I
good
had to
move.
do the sternal rub with my knuckle because that is very unpleasant and that'll wake people up.
Mhm.
And then once they're up, they're gonna puke. So I go and get the
Fun.
trash can.
Boy.
And then after that, and I feel like they're good. And obviously I get them a wet washcloth for back here and ice
Mhm.
packs and such.
Mhm.
Then I assist them to the bathroom because they gotta go number 2.
Lovely.
Yeah,
Lovely. You're
it
working in the
happens
hospital again.
every time. Every time someone passes out, it's like, "Yep, I know what's next." It's all the same.
Now, I
Oh,
haven't
yeah.
had anyone go to that extent. I've had lots of people pass out, but not I've never had anyone throw up.
Really?
Yeah.
I have.
Oh boy. Oh boy. Well, I usually catch it. I know when I'm injecting, I just stay aware of the color of their lips, if they start to look
Yes.
a little pale, if their eyes start to bat a little bit, like,
Yeah.
funny eye movement, they start
Right.
to sweat. So then I'll stop. I'll say, "Take a breath." If I see them doing it, I make them start deep breathing because they can get out of it quicker if you catch it and have them
Right.
start to deep breathe.
Yes.
'Cause they hold their breath because they're nervous or they're just afraid, and it's just about holding their breath. It's
Yeah.
all it's all kinda mental, it's very bizarre, but yeah, as long as, we know what signs to look for and try to stop it from continuing. If they do pass out, it's not a big deal, we know how to handle that. There's always 911 if we have to call 911, which we've never had to do. No, no, no. We've s we've saved their lives. No, it's but I always put it in the chart as a pop-up client add to passing out,
Yeah.
syncopal
Syncopal
episodes.
episodes
Yep,
or
yep,
vagal.
bagel, bagel. Mhm. Yep, yep. What is the funniest reaction you've seen when a client first looks in the mirror after getting fillers? Any funny reactions?
Funny? No, not really. Not funny. They're just like, "Oh, I love this," or, that's pretty much it.
Have you ever had someone cry?
Not because of that, but for the pain. But the
Really? It's not
Yeah,
supposed to hurt.
I haven't, but she came in, like, weeks later. The one client who her cheek filler migrated down. I don't know what happened. No idea, but do you remember her crying?
Mhm.
Yeah,
Yeah. He was upset about that, which was fixable. There's
right,
no reason to cry. We can always fix things.
right, exactly.
Yeah. So, I have had some clients cry after I've treated them with filler because they were so joyous. I've done a lot of correction on lips. I have a couple clients actually that have had Mohs surgery, and so by correcting some of the irregular borders and some of the tissue that's been biopsied out that never filled in, I've been able to correct some of that in the symmetry along with Bell's palsy. And I've had some people cry because they were crying with joy that they had improvement, which
Nice.
that is so, like, rewarding. I think that's the best
Oh,
rewarding
yeah.
piece of working in a medical spa is that type of client.
Yeah.
Yeah.
I haven't
It's
had them cry, but they'll be overjoyed.
yeah. Yeah. What was the most unusual request you've received for filler placement?
Hmm. Usual request. I mean, to me, biostimulator in the rear is not unusual to me.
Yeah, BBL.
Yes.
That's not really unusual.
No, no. I just have to say the weirdest thing, and it's not really filler, was the Kybella to the cheeks. I haven't had any weird requests. I mean,
Mhm.
and then like unsafe requests where I told you like people will want that line filled with filler, and that all depends on the client.
Mhm.
Cause yeah, that's unsafe.
Yeah. I can't really think of I've had some clients ask me if I would put filler in their forehead, a high forehead. And no. They have asked me to do a brow lift with filler before, and I have done that. I have done
I
that.
have not. Wow, Amy.
That
Okay.
was a long time ago. I haven't done it since, but yeah, I did do a little lift with some filler right at the tip of the tail. I
Send it to
also
the ear.
what? Earlobes, I was gonna say that's one of my favorite things to
That was fun.
do, fill
Yeah.
earlobes. It's just magic. It's like you put it in there and the ear just looks so much younger. It's
Yeah.
amazing.
It's so easy.
I can't think of anything offhand that's really bizarre. We'll fill anything. We really will. I haven't been asked to put filler in a penis before, and I said
See,
no.
I
I
have
said
not
no.
done any of that, so
I
that's
know it's
usually your territory.
a thing. I know it's a thing, but I won't. It's too vascular. There's too many pieces going on down there.
Yeah.
I'm not comfortable with that. So you can go to Miami for that kind of thing. They do it there. Go to Miami. They're crazy over there.
Yeah, I guess
They'll
so.
do anything.
Put filler.
And I won't fill noses. I won't do it. I would love to do it, but I just don't think that that's safe. If I always say if I can't take them to the OR to fix it, I don't need to be doing it. So
Right.
I can't fix it.
You remember that training in France?
Yes.
That was
We get
cool.
to that was cool. We got to fill all kinds of things with Everlite. I always wanna say Everlite.
Elise,
Evolysse, the new
Elise.
filler. We got to fill noses and temples with cannulas and needles and did all kinds of cool things on the
Yeah, that was
cadaver
cool.
at the university in Paris. That was amazing. Yeah,
Yes.
that was great. Okay, so let's see. I know I have so many questions to ask you, and you have a lot of funny stories to tell because I've heard some of them. Oh, I know. Has a client ever tried to move their forehead right after Botox and said, "Is it working yet?" And what do you say about that?
It takes time. Oh my goodness. Well, it all depends.
Have you had somebody do that?
So I actually had, you remember when I, a long time ago, gave my phone number out? We're doing that again. And a
Mhm.
client texted me at 11:30 at night to tell me that her Botox didn't kick in. And I did it like the day before. Like it doesn't work like that.
Yeah.
So
I have heard that it can kick in within 24 hours. It's very rare, but not Botox. I'm
yeah,
talking
she was
like
Botox.
Daxify and Juvo. I have heard that, and I kinda can believe it, but only if they're naive and they've not really had toxin before.
Yeah.
Not someone that's had it for years. I don't believe that works, but yeah, I've had some people that said they felt it immediately work,
Yes. I've had people say that.
and
Yeah.
in the car, boom, it was working pretty good on the way home.
Right.
That is not really typical, but if that's what they wanna think, I'm excited for them, and I am glad. I'm
Yeah.
glad they feel that way, but it's usually what they're feeling is the pressure of the fluid that's been
Right.
injected to the muscle, so that's what they're feeling. It's not actually working yet. It does take time, like 3 to 5 to 14 days, so they gotta wait. What's the most creative way a client has tried to describe the look they want?
Most
That's a hard.
creative way.
Yeah.
Oh gosh. So when they pull out their phone and then they are like, well, in the lighting, when I'm looking at it, like no joke, I've had people say like in 30-degree, what? In the shade, when there's a shade. So it's just, I don't know. They always have their phone, and in the comparison, I have this shadowing or I have this depression that shows when the sun is at an angle.
Mhm.
Hey, I
I
don't
hear that a lot.
all right, I'll look for it.
Yeah. And a lot of times too, it's, like, say, under the eyes, they may
Yes,
have dark circles under their eyes, but I always do a skin check because if the skin is discolored, there's really nothing we can do.
yes,
It sometimes popping it out with filler can allow some of the light to reflect off of it, but if they have some discoloration under their eyes, as far as the tissue, the skin, it's really hard to make that look better.
yeah.
There's, like, under eye peels that we do that helps lighten it. We can use hydroquinone, that can help. We can even try, like, the vascular laser, the 1064, the IPL underneath there to try and lighten some of that, darker hyperpigmentation. Yeah, it sometimes takes more than one treatment and more than one modality to help some of those areas. So, yeah, I had a client come in last week and she said, "Oh, I have see this divot after you gave me cheek filler." So I took a look at it and it was a hyperpigmentation. So what had happened is when I put the filler in her cheeks to give her volume, the skin had already it had that hyperpigmentation there
Right.
naturally. It just popped out. So she just recognized it more because her cheeks were fuller.
Yes. Yeah.
So I said, "No, that's always been there." We looked at her before pictures. I said, "It's just that you're noticing it now because you have fullness in your cheeks again." And so she decided that she's probably gonna do IPL and try and lighten that.
They
Also with
seem
some
to make a lot of it like right here. There's like this dark line for some reason. I notice on some.
along the cheeks. Mhm.
Yeah.
Mhm. I can sometimes people who wear sunglasses all the time, especially in Southwest Florida, we do, will have a sunglass line. Have you seen that?
Yes.
Yeah.
That sun is
Sun
beaming.
the
I'm
sunglass
sorry.
line. So what we can do is just fill that in a little bit and then tell them to maybe change wear those glasses that causes that crease on the eyes. It's like putting pressure on the cheek constantly, and so it's gonna
Right.
cause an indention. It's
I've
just
actually
pressure.
seen, for some reason, people hyperpigment here with their
Where
sunglasses on,
where?
right here,
Describe where you're talking.
like the bridge of the nose.
Okay.
Yeah,
Alright.
yeah, they hyperpig, and they're like, I wear glasses and SPF. How could I hyperpigment?
Because it's the closest to the sun. Your nose. I mean, think about it. Cheeks and nose, they're like protruding off of your face. So they're like a little beacon for the sun. And that's usually why you get hyperpigmentation there more so than anywhere else on the face. And also, we know the driving side, your left side of your face, we see more hyperpigmentation from that too. Okay. So, what's the funniest myth about Botox you've heard from a client? I've heard all kinds of things.
So where do I begin?
Exactly.
Well, the latest one is that chin toxin can lead to jowling.
Okay. Okay, so how did this client come up with that idea?
She probably Googled it. I don't know, but I Googled it and it's like, no, it says no. I don't, or TikTok. TikTok is Satan. I swear to God. Gosh,
So much misinformation on TikTok, and
there's, yeah,
everybody believes what they see. It's really quite something.
it's not a credible source. So you
No.
can't always go off of what TikTok says or what people,
Right.
yeah, drives me
Yeah.
nuts. Yeah.
Right.
Stay off
You
the
have to
internet.
stay off. Yeah.
Let me do my
Impossible.
job.
Yes. Yeah. So, Botox in the chin cause jowling. That is a myth. That is not true.
Yeah.
What else have you heard?
What else did she say?
Now, we do know Botox, and when we say Botox, we mean all the neurotoxins. There's 6 that are FDA approved in the United States right now. We use 5 of the 6. Botox can cause eyelid droop.
Again.
It depends on where it's injected and how much is injected, but sometimes other things can cause it, and it's not the Botox.
Right. Right.
So, I know people that have allergies, they can have a little bit of pressure in around their eye and swelling, and that can be a cause, and they might blame it on the Botox, but if they start taking allergy medicine, which sometimes I'll recommend, they'll notice an improvement. Anything else?
Static lines are gone with one boat.
Oh, I like that one. That's one of my favorites.
Yeah. It doesn't go away.
Static lines are those lines that when you're not using your muscles, you can see them. So, say that you're just looking at someone's face and they have forehead lines that go across their forehead. If they raise their brows, they get deeper. But when they relax, you still see the lines, and those are static. And so, some people think that right when they come in and they get their first dose of Botox in their forehead, those static lines are going to go away. And that is not true. It takes months, almost a year. It depends on how deep the static lines are, but they can make them look better if they keep up with the toxin every 3 to 4 months and not let it wear off.
Right.
Yeah.
The repetitive motion is what causes like kind of scarring. It's a static line. It's just the same repetitive motion. So every
Mhm.
3 to 4 months, keep up with the treatments.
That's right. Every 3 to 4 months is what we recommend. And I know it's like, "Oh, it's a commitment." So many people come in and go, "Okay, I'm starting Botox treatments, and so this means I'm gonna be stuck for life, right?" Well, you're gonna get used to it, you're gonna like it, and you're gonna wanna keep up with it. Yeah, and as you get older, it only gets worse.
Yay.
Yeah, love the aging process.
Yeah, me too.
Okay, let's move to lasers.
Lasers.
Lasers, we got funnies on the lasers. Okay. Has a client ever asked if the laser will make them glow in the dark?
I haven't had anyone ask that. I wish I did. I really did.
Sounds like something my son would ask. He would ask something like that. No, I haven't heard that either. That's no. What's the most unexpected reaction you've seen during a laser procedure?
So I'll have a client. I had a client ask, like, "Is my face burning off? I smell it." I'm like, "No, it's the peach fuzz of your face."
The hair,
Mhm.
when you use a laser, the hair can singe.
Yes, it's a
Yeah, and
very
it does
distinctive
smell
scent.
kinda well, it smells like burnt hair.
Exactly.
When I'm doing laser hair, it's so funny. I'll say, "Oops, you missed a place with the razor," 'cause, you can smell the hair that's
Yeah.
above the skin that gets burnt. Yeah. Yeah, it's kinda crazy, but have you ever had a client ask if they can laser just half their face to compare results?
No, but I've had people ask, like, "Can you just do this one little area and would it be cheaper?" And like, it won't look right because that one little area will be like beautiful and perfect, and then
Yeah. Yeah, we recommend you do the whole face if
the
you're gonna
whole
do
face,
it.
make everything uniform. Don't just half
Right,
piece it.
right. Unless, of course, we're lasering a lesion,
Right,
you
right. A
know,
scar, and but just no, not one little area.
not one. No, not one spot. What's the oddest item a client has brought to entertain themselves?
I
Well,
was
we see a lot of cell phones. That's not odd, though.
Yeah, that's not odd.
I had someone bring their dog
Yes, I've had someone bring their
and had their dog on their lap,
Okay,
which
no, my client did not have this dog on their lap.
I am totally against that because dogs are not the cleanest things on earth.
Right.
However, she was so nervous and she uses her dog as an emotional support for real. And so I let her keep her dog. But yeah, we had to kind of keep the dog. It was a little dog on her lap. We had to keep the dog
Good
kind of
worry.
away from the
Oh!
tray. And I was at the head of the table. So at the head of the where she was. What were you going to say?
Oh my gosh, I'm sorry, this, popped up in my brain. Someone brought in a snake, and I thought it
A snake, like a live snake. What
Yeah,
kind of snake?
yeah,
Like a
wrapped around
boa?
her neck.
She walked in the spa with a boa around her neck? Are you
Yeah, it
kidding me?
looked like a scarf at first until it moved.
So what did she do with the snake when you treated her?
So, it's so funny that Zoe had to babysit the snake. So,
I bet they'll love that.
she did. She was very entertained by the snake, so
That is crazy. I didn't even know this occurred. Wow.
yeah.
The things I learn on podcasts.
Sorry. It actually wasn't my client. I just came in after my client and I'm like, "What are you doing with the snake, Zoe?"
Oh my
'Cause I'm
goodness.
holding it for a client.
At the front desk for everybody else to walk in and see? Yeah, not cool, not cool. Uh,
But
yeah,
I
I
don't
don't
know why this I don't know why you bring a snake, but maybe that's her emotional support. I don't know.
yeah, I don't know.
But
Well,
the
let's
certain
not have any more
injector
snakes in the spa again, okay?
yeah, the certain injector was like, I don't inject well."
Good, good. Who was it? Wendy. Yeah, good job, Wendy. Okay, so got some more. What's the funniest question a client has asked while filling out their intake form?
It's unfortunate that I do not get to see, or I don't really converse with clients when they're filling out their intake form because usually
Mhm,
they're in the front and
mhm.
filling that stuff out.
Or they have it done before, so you don't have any funnies on that.
Yeah,
Yeah. It's pretty easy to fill out and, it's
yeah.
there's yeah, I've never some people just yeah.
Sorry, I keep
Yeah,
in.
no.
My God. Will my picture be on social media? That's a lot of question. They,
But will my picture yeah.
yeah, they
And they
ask
have
that
to
a
sign
lot.
a consent for that. Mhm. Yeah. And even if they've signed the consent, I still ask in that moment, "Can I post this?" Because
Right.
they might change their mind, So,
Yeah.
yeah. Okay, so have you ever had a client bring a friend or partner for moral support and the reactions were even funnier than the client?
Oh yes. Yes.
Okay. Tell me about it. You
So
have a story?
I've had quite a few. So it's not just one client. It's the younger generation when they get their lips done and they bring their boyfriends and their reactions, the boyfriend's reactions. It's priceless. It's absolutely
Mhm.
they look mortified. Yeah.
They look mortified?
They
Yeah.
look mortified and their partner that's getting injected, I mean, they're fine. We put
Mhm.
topical numbing cream, so they really don't feel anything. But just to see the boyfriend's face on, like, see what we do for beauty.
Mhm. And I think men are more squeamish than women when
Yes.
it comes to needles.
Yeah.
I know, like, when we treat men for Botox, any kind of toxin, they are a little bit more antsy in the chair.
They
That's
buck.
what Huh?
They buck.
They do buck. They do buck. They move their head. I have to tell them to be still. I give them a stress ball or 2 stress balls so their hands have something to hang on to.
Yeah.
So,
I
I
give them
agree.
the vibrating,
Oh, yeah.
the nerve
They
diffuser or whatever, distractor.
Mhm.
Yeah.
What's the most creative excuse you've heard from a client about why they need a treatment?
Creative excuse.
Yeah, why yeah, what's the most
Hmm.
creative?
You seem to jog my memory when you bring up things. How about
I
you?
know. Yeah, oh, okay, so well, when during COVID,
Yeah.
I had a lot of new clients come in, and they said, "I was on Zoom, and I don't like how I look, so fix me."
Yes.
I had a lot of people come through, new clients, and say, they wanted some treatments. They usually started out with Botox because they didn't like the lines they saw on Zoom. And actually, the industry boomed during the COVID era,
Yes.
which was crazy. but people were more home and looking at themselves in the mirror every day and on Zooms, and yeah, it really changed the industry, I think. I think also other reasons I hear, I just don't like how I look. I'm getting older. I don't want my husband to know, but I don't
Yeah.
want to look older.
There's
So
a
just
lot of those.
do treatments, that are very low and slow. Start out, with toxin, only do this area. And then when I come back, I'll do a second area and just kind of start adding on services to slowly show some improvements over time. Yeah.
I actually have had a few lawyers as clients, and they're like, I want no expression.
Really?
Yes.
That's interesting. Okay.
I even had a male lawyer. He can read people. It was kind of like very interesting talking to him. So he's like, I can't look angry because that will make the jury think that, that I don't know. I don't remember what he said, but I was just sitting there like, oh my
Wow.
goodness. Wow.
There's a group of people we need to market to, attorneys.
Oh,
Didn't
yeah.
even think about that. That's interesting. Okay.
Yes. Yeah.
Nice.
As
Okay.
soon as they have that angry face, they're like, I need to be frozen so I can't show
Mhm.
any emotion in the courtroom. And I'm like, oh, I could do that for you.
Yeah. I have several clients that said they knew it was time to come in because their children told them they looked angry.
Yes. Yes.
Mommy, you don't look happy.
Yeah, you look
Time for your
angry.
Botox.
When's your next injection?
Yes, yes, yeah.
Yeah.
So, any other like stories that you can think of that are just myth busters or funny stories? You've had quite a few. I know, but we need to make a list of them next time so you
Yeah.
can hit all of them.
I think like the only thing that I had because I was trying to figure it out myself. And the IPL and the CO2 can possibly cause hypopigmentation. I mean, that's true.
That is that is true. That is true. I have a spot that I have a hypopigmentation spot from the IPL.
Yeah, I do too, but I'm fine with it.
Yeah, I think it's better than a dark spot, don't
Me
you?
too.
Yeah, I can live with it.
Right. Right.
Usually a steroid is something that we use to help treat it. It's really almost once you damage those cells, you just can't really get them to come back. You can tan it. It will sometimes get darker with a tan and kind of blend.
Yeah.
But yeah, there's nothing really you can do once you hypopigment. And, it's just something that can happen. I think mine was caused from the IPL. I was training someone, and I think it was just a little bit too, the settings were too high, but, my face is a training ground
Yes,
for
it
all
is.
the injectors. Yeah, it is what it is. Now for a client, I'd be really upset about that. So we do everything we can to try and prevent those
Right.
issues, but that is something that can happen. Yeah. So what is your sweetest tip of the day?
Sweetest. And I was thinking of one last night, and I wish I wrote it down. My sweetest tip of the day. Just love yourself. Don't be so rough on yourself with, dysmorphia, So many people are just so critical of themselves. I know I said that a lot with the self part, but I just hear these stories of people hating certain areas of their face, and it's like it's not that bad. You're so
Mhm.
harsh. So
Mhm.
just love yourself and the way you are.
Mhm. Yeah, I agree. Good job. Now, if the listeners want to ask you questions, how can they get in touch with you? No phone numbers.
No. Where's my husband? What phone number I'm giving is the Sweet Spot MediSpa phone number.
Okay.
Yeah, so
098. What about, can they contact you on Instagram?
they can. I'm under Injector Perfector DNP, and they
Okay.
can find
And
me there.
I'll put your link in there. Thank you for joining us on the Glow Up and Get Real podcast. Here's to fearless beauty and real talk. Until next time.